Hello, how are you? I'm so sorry to hear that. So it's been 3 days since your surgery, and I see that your incision was on your right leg. So I'm going to try to be very easy on that, but I need to check many things about your leg and also your pelvis and abdomen to make sure that the infection hasn't spread. We removed quite the large boil from your leg, so it's gone now. But if I find an infection that has spread, we might have to remove your leg. So I hope that that's not something we have to do. However, I just have to let you know that. Alright. So, but not to worry, just try to relax. Can I have your first and last name and date of birth? Okay. Okay. Well, you look very young for your age. Okay. Any allergies or medications? No. Family history of hypertension? Blood disorders? Lung disorders? No. Any medications that you take on a daily basis? Right, I know, I should have that in my chart. However, I'm an interim nurse, so your regular nurse wasn't here to give you the exam, so I don't know much about you yet, but hopefully that will change throughout the process. Okay, so I'm going to check your vitals, and if you have any other questions, alright, I'll begin. Okay, I'm going to start by listening to your heart. So just breathe normally for now. Okay. Heartbeat sounds normal. Okay. Very good. Going to listen on the both side. No murmurs, no extraneous sounds. Alright, I'm pleased with that. Okay, we'll listen to your lungs, so just breathe normally again. I don't hear any crackling or wheezing. Breathe normally. Okay. So now I want you to take a few deep breaths. So on the 3, 2, 1, inhale, and 3, 2, 1, exhale. 3, 2, 1. Good. 3, 2, 1. Excellent. Okay, let's try the other side. 3, 2, 1. And 3, 2, 1. Okay, so next I'll take your blood pressure. Your lungs and your heart sounded very normal, so not to worry. Okay. I'm going to slide this up your right arm. Alright. It's going to rest right there. And I'll be giving it a listen. Okay, don't mind me, I have to lean over you. I hope my breath is fresh. I'll be getting much closer quite soon here. Okay. Sorry, is that tight? Good. Alright. Blood pressure is 119 over 89, so it's slightly elevated. Okay, I'm going to write that down. So, slightly elevated blood pressure. Okay, next I'm going to take a temperature. So, stay still. That is 98.1, so that's normal. So how's your head feeling? No puffiness or swellingness? Headaches? Any nausea? Okay. Well, it's procedure that I check your hair for lice or infestations, so I'm going to do that now. So just try to relax. This should feel not like a pulling sensation, but just more like brushing your hair. So you don't have a lot of hair to brush, so that's a good thing. And it's not tangled. Okay. I don't see anything here. I see a little bit of dandruff. Do you get dandruff normally? Okay. So, even though this is not the reason why you're here, I'm going to prescribe you with a dandruff shampoo. Okay, to take home, because it is quite a lot of flakes here. So, how often do you brush your hair? Right. Okay, I think brushing it a little less often might be the trick. It might lessen the amount of dandruff. Something to try, and also using the prescribed medication that I give you. Okay, great. I'm going to palpate your head. Try to relax. You don't get any lumps or bumps. No concussions. Do you remember falling at all in the last week? Did the nurse drop you in your wheelchair after your surgery? From the surgical unit to your bedroom, did you fall at all? The nurse didn't tip you over for laughs. That's good. Okay. Then I'm not worried about a concussion. Okay. I'm going to be touching the front of your face. Is that all right? Do I have your permission? Okay. I'm just feeling for any swelling, feeling your sinus cavities as well. Okay. For any infections here, I'm going to be touching. Try to relax. Lovely. Does that feel like a massage? Oh, good. I don't feel any edema, but you know what? To make sure, I'm going to do some measurements. All right. So what we're looking for here is perfect symmetry, so that if one side is larger, that could indicate fluid buildup. I don't see anything here. 4 inches on the right and left side. 4 inches on the right and left. Okay, let's do the nose to the ear. The nose to the ear is 4.5. 4.5. Okay. And the other side, nose to ear. This is 5 inches. So your right side is a little bit swollen. It corresponds with the right leg that you had your surgery on, so that could be a culprit. I'm going to write it down and we're going to monitor how it's going, okay? All right, I'm going to measure your chin now. It's a nice sturdy chin that you have. Okay. And your forehead, from the very center to the hairline. That is 4 inches, and the other side is 4 inches as well. I'm seeing generally perfect symmetry. I'm going to feel your lymph nodes, okay? Right here. So you have lymph nodes down by your chin, but also in front and behind your ears. Those are called your preauricular lymph nodes and your postauriculars. So I'm going to feel the preauriculars. Oh good, they're non-palpable, which is what I want to see. I'm going to check right behind the ears as well. Okay, Very good. Okay, I'm going to do some facial myotomes now. I'm going to place my hand right here on the side of your face. Turn your head all the way that way, okay? I'm going to resist your push. This is a strengthening test. 3, 2, 1. Good, perfect strength. All right, the other side. 3, 2, 1. Excellent. Now try to look up at the ceiling. I'm going to place my hand on your chin to prevent you from doing that. 3, 2, 1. Good. Now try to touch your chin to your chest. 3, 2, 1. Excellent. Okay. So, no loss of strength from the surgery, at least when it comes to your face. I'm going to be checking your facial sensations now. May I sit down? Good. Okay. Thank you very much. Sometimes leaning over like this for too long really hurts my back just a little bit. Don't tell my supervisor. We're really not supposed to be sitting on the bed, but thank you for allowing me this. Okay, so this will feel like a dull sensation. This will feel sharp, so let me know if you feel sharp or dull. Okay, close your eyes or else the whole thing is a moot point. Okay, good. Nice. Okay, and I'm going to be using the sharp tool. Go ahead and let me know if it's on your right or your left side. Say right or left. Good. I got your nose. Excellent. Okay, so next I'm going to check your temperature sensations. This will be a cold sensation. This will be warm. So say cold or warm. Good. Yes. Keep those eyes closed. Good. Yes. No, that was warm. Let's try again. Okay. All right, now you're getting the hang of it. Just a few more. Right, so you got those all right for the most part. I'm going to check your eyes now. Okay, I'm going to start with my hands outside your field of vision, slowly bringing them in. Tell me when you see my hands when they enter your field of vision. Say now. Good. 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 Lovely. Okay. Now, let me know which hand I'm moving, your left or your right. Good. Both, yes. Both, yes. Which hand is further away, your left or your right? Good. Which hand is closer, my left or my right? Yes, very good. Okay, I want you to go ahead and follow this light. Keep your head straight, don't move it at all. And ignore my fingers, just follow the light. This is to judge your depth perception, which it looks like you have down to a science. Lovely. Well, don't move your head. Very good. Okay. Okay. So next I'd like you to follow my fingers and ignore the light. So follow the human, ignore the spaceship, as I like to say in all my videos lately. Good. Very good. I'm going to give you a quick color test. What color is this? Orange, yes. What color is this? Black. What color is this? Green. Is it a bright green or a dull green? Bright, yes. What color is this? It's a reddish orange. Okay. Can you read? I'm glad to hear. What are these first two letters? Good. Can you read them the opposite way? All right. What about this row? C, E. Good. Okay. And the last row? T, A, N. Good. And the final row? C, E. What is this animal? Do you see here? There's an animal in red and orange. Good. It's an owl. Lovely. Okay. And the author is this book. Could you read his name? Jeff Vandermeer. Yes. Close enough. Okay. So you can read very well. I'm not worried about your eyes, although I'm going to take a quick peek. So I'm going to come a little closer and look inside your lid and your pupils, seeing if they're round and reactive. Yes, they are. Okay, no signs of jaundice, excess veinage, no redness of the eyes, no styes. Are you prone to eye infections? Never had one. Lucky you. Going to look at the other eye. Okay. Same thing here, nice and moist, no dryness. Pupils are round and reactive. Very good. Okay. I'm going to be checking your ears and your hearing now. This is a tuning fork. I'm going to make a sound. Do you hear this? Did it stop? Good. Close your eyes. Let me know when the sound stops. Simply say it stopped or stop. And don't peek. Lovely. Good. Good. So, which is louder, position 1 or position 2? This is 1, this is 2. Good. This is 1, this is 2. Excellent. This is 1, this is 2. Very good. Okay. Not worried about that. I'm going to be making a rustling sound in your ears. Let me know if you hear it on the right ear or the left ear. Good. 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 Okay. So you got that right. I'm going to be whispering some things in your ear. Let me know exactly the words you hear. Crumpet. Tea. The Queen. The King. Prince Harry. Princess Diana. Okay. I'm going to do the other ear. The Tudors. The Downton Abbey. going to look inside your ears. If you could turn your head this way, I'm going to see your tympanic membrane. It's a nice pale grey, and no scratching or scarring, no damage here. Do you listen to headphones? I don't see any scarring, so it looks like you keep the volume at a reasonable level. Kudos to you. Have you been to any loud concerts? Not lately? Alright. You don't have much wax either. Go ahead and move your head the other way so I can look inside the other ear. And I see your tympanic membrane is beautiful pearl grey. Lovely. No earwax. Impeccable. Beautiful. So, next I'm going to check your body and your facial sensations to vibrations. Okay, so I'm going to make this sensation with this vibrational tuning fork. I'm going to be placing it on your forehead. You should feel the sensation equally on both sides of the forehead. Let me know if you don't, and say yes if you do. You do, good. Now, I'm going to be placing it on different sides of your face, such as your chin, the sides of your head, the bony prominences, and let me know when the vibration stops, okay? Good. Good. Perfect. Very good. Okay, I'm happy to say I've tested all 12 of your cranial nerves and they're all very healthy and normal. The only thing so far that I'm slightly worried about is your high blood pressure, but it's not that high, so don't worry yet. I'm going to palpate your chest and we'll do an abdominal exam, okay? Let me know if you feel any pain. This should just feel like a light pressure against your chest. Okay, take a deep breath for me. Okay, very good. I'm not feeling any edema. I'm going to quickly measure. Okay. 9 inches here, 9 inches, so perfectly symmetric on the chest, on the sternum to the sides of your body. Very good. Okay, just going to be palpating. Excellent. All right, I'm going to be doing an examination on your abdomen. Do I have your permission to peel back the blanket? Good, okay. Just going to be palpating, listening for your organs, different sounds that might pop up. Okay. Okay. Going to be listening. Just relax. Okay, no need to breathe any special way. Sounds are normal so far. Okay. Your stomach seems to be rumbling. Are you hungry? Okay. When's the last time they brought you food here? Okay, I'll make note of that when I leave and hopefully we can bring you in a snack because it sounds like your stomach really needs some food right now. Sorry about that. I'm going to be doing a sharp abdominal test. Let me know if you feel a sharp sensation or a dull sensation. Good. Okay. Okay, so some slight numbness on the right side. Sharp or dull? Oh, you didn't feel that at all? Okay. Interesting. You don't feel that? Not at all? Okay. So some numbness on the right side of your abdomen. Okay. Going to be doing some palpations. Just relax. Feeling your liver, your spleen, different organs, making sure they're nice and normal sized. We don't want anything enlarged. I don't feel any abscesses. I don't see any lumps, no bumps, so that's good. Your liver is normal. Spleen normal. Diaphragm seems to be normal. Take a deep breath. Was that hard to do? Okay. So just the numbness. So right now I'm pushing quite hard on your stomach. Do you feel it? Slightly, but not hard, because I am applying quite a bit of pressure. No, you don't. Okay. Going to make note of that. Just continue to relax. Nothing to be worried about. If I saw an abscess or a boil here, that might be a reason to amputate your leg, but I don't see anything like that at all. Okay. Very good. So, I'm going to be applying a tuning fork to your stomach. Let me know when the vibration stops. Okay. Good. Did you feel it stop? No, not on your right side, so having some problems there. Oh, it's starting to storm. Very relaxing sounds. No? Okay. So that's something to monitor as the days progress. I'm going to be feeling your legs now. I'm going to be feeling very lightly on your right leg. It is healing, so I'm not going to be applying too much pressure there. But I need to assess and compare, so very lightly on the right side. Excellent. Okay. So I do see just visually that the right leg is swollen, that the right leg, I do see just by looking that your right leg has some swelling. Alright, I'm going to measure, and I know that this symmetry is not going to be present, but I need to know exactly how asymmetrical the measurements are, so bear with me here. Okay, 3 on the left knee, 4 on the right, so it's an entire inch of difference. That is not worrisome because you're still fresh out of surgery, but it is quite a difference. Yes. am seeing some edema at the ankles. So what I'm going to do is I'm going to apply a very light pressure to your ankles just to stimulate blood flow. Does that hurt? No, good. Very lightly here. I don't want to impede the healing process. Okay, and it's right along the side of your right leg. That's where the sutures are. So, okay. Now I'm going to be lifting the blanket just so I can see and make sure there's no discharge or pus coming out of the incision. Okay, no leaking here. I'm going to take a look here with my light. And I see here, it looks very clean. No leaking. You're going to have a bit of a scar, I can tell you that. But I don't see an infection. No pus. And the stitches are very tight, so your surgeon knew what she was doing. Absolutely. Nothing to worry about here. Just the swelling. I'm going to speak with your surgeon, give her the numbers, and she's going to tell me if it's out of range or not. And so if she believes that there's a problem, she'll come in here and do an examination herself. Okay, but I think we're out of the woods, as they say. If you're worried about having to amputate your leg, you get to keep your leg. Oh, you're relieved. Were you worried about that? I would be too. Okay, I'm going to check your feet now. Do you feel me squeezing your right or your left foot? Good. All right, do you feel this pressure on your ankle or the pads of your feet? Ankle or pads? Good. Ankle or pads? Very good. Okay, I'm going to test your Babinski response. Okay, lovely. And again, very good. A nice reflexology. Let's do a sharp and dull test on your feet. Okay, do you feel the sensation? Good. Do you feel the sensation? Was that sharp or dull? All right, go ahead and say sharp or dull. Yes. Okay, almost finished. Okay, going to check your capillary refill to make sure it's 2 seconds. 2 seconds on the big toe, going down the toes. Yes, all the little piggies look like they're responding to me in the 2 second time frame, so I'm happy about that. Very good. Okay. Okay. So, I finished your examination. Everything looked very normal, except there were some points of worry. Your swelling on your legs, not so good. Loss of sensation on the right side of your abdomen, not so good. And your blood pressure was slightly elevated. So I'm going to bring all these things to your surgeon and your regular nurse on duty. So she's going to go ahead and come back in and do a more detailed assessment. Your vitals, none are too alarming, so I wouldn't worry if I were you. You get to keep all the limbs of your body, so I'm glad to be the bearer of good news for that. I'm going to go ahead and let you rest. I'm going to leave now. And hopefully I'll send in a note about bringing you a snack or a meal, because it's time for you to eat. You need to nourish yourself to be able to heal. Sometimes the nurses and staff on duty, they don't realise that, or they forget it. Other than that, I'm going to let you go. Thank you so much, okay? Goodbye.